Also have apologies from Deputy Jonathan Renouf and Deputy Lucy Stevenson, who aren't able to join us today. Minister, if you could introduce yourself and the members of your team.
Hello, I am Deputy Lyndsay Feltham and I am the Minister for Social Security, and I'll let Sophie introduce herself.
Hello, I'm Sophie Lesweur. I'm the Chief Officer for Employment, Social Security and Housing.
I'm Suda Howell. I'm Associate Director in the Cabinet Office.
Welcome, and yes, thanks very much for making some time to come and see us today. Have you guys understood the statement, Minister?
Yes.
Yes, okay. We don't have anyone in the public gallery today, but hopefully there might be some people watching online today.
Hopefully.
Okay, so we have an hour and a half for the hearing today, and if there's anything that we aren't able to cover, we'll send those on in writing after the hearing. Okay, we're going to open with some questions around the cost of living. And Minister, I'm sure you'll be aware that the cost of living is a growing concern for islanders. Could you outline how you plan to tackle the ongoing rise of the cost of living in Jersey?
I think that the issues around cost of living can't be dealt with by one minister on their own. It's very much something that we need to work with across the Council of Ministers and across a whole policy agenda for the whole of government. I am, of course, on the cost of living ministerial group, along with the Treasury Minister, the Minister for Economic Development, the Housing Minister. I'm just thinking if I've left anybody else. And the Treasury Minister.
So Treasury, Economic Development, Housing, did I miss any?
And Social Security.
And you, yes, of course, yeah.
So I think it's important that we all work together. We all, of course, know that one of the biggest issues around cost of living that we know through the Jersey Opinions and Lifestyle Survey is housing. So, of course, it's important for me to work with the Minister for Housing in particular. We have, of course, we will see the increase in the minimum wage to £13 an hour come 1st of April, and to help businesses put that in place without then leaving to kind of more inflationary pressures. We obviously have the Better Business Support Package as well, so that's an example of how I'll be working with the Minister for Economic Development. But I'm also keen to hear directly about the issues facing islanders. I know that recently there was an article in the Jersey Evening Post that arose from an interview with the head teacher at Hope Valley School. So following up on that, I undertook to go and meet with that head teacher to hear directly about individual circumstances. Of course, we can't discuss individual cases in here, but I'd be happy to talk to you in private. And each time we get an individual circumstance kind of across my desk that points to, say, a gap in provision, I do, look to see how we can resolve those circumstances, but also then to see what might be the root cause so that then we can address it within government as well.
And I understand you can't talk about the individual circumstances, but are there any patterns that you've identified?
I think what we do know, and again this was borne out by the survey results provided by Stats Jersey, is that families with children, they are in a difficult position, working families. So that, and again we met with the Jersey Childcare Trust just a few weeks ago, the cost of living ministerial group, to hear directly from them as well. And I've also met with Brighter Futures to discuss that, but also families with children, but also more so people that haven't been here 5 years and don't have access to income support provision. So that's why I implemented the special payment last year as we transitioned towards a living wage for those people who are the lowest earners within that bracket. I think it's really important that they know that they're valued in our community, because we really do need them.
Yeah, okay. Thank you. So in terms of the cost of living ministerial group, could you identify some of the items that have been on the agenda of that meeting? You've just mentioned meeting with groups like community, you said childcare trust, wasn't it? Yes, and Brighter Futures. But what actual kind of actions or discussions have come out of those things?
So it will be that group that's leading on the minimum income standard piece of work. So we'll be looking at that on the next agenda. Also, that group has kind of the broader ministerial oversight as well of the Better Business Support Package, so that gets also brought into that group as well. So those are kind of the two key items that I can recall that's on the next agenda for that particular meeting of that group. I'm quite keen, as you know, I've said it before, to get the work done on the minimum income standards. We've got budget in place for this year. I think the last time data was gathered was the late 90s. Yes, Sue has a long memory. The data gathered in the late 90s. Obviously, lots of things have changed since that time period. People's spending habits have changed, and I'm hoping that being able to deliver that piece of work will give us better information about where we should be setting our benefits. It also inform things like our minimum wage as well. It's really important that those things work in tandem, isn't it? That we're really responsive to the actual issues that people face.
What are you expecting to find from that data? Do you have any inkling of what it would look like?
I suppose we know what we know now. We know what we hear in the community around the cost of housing, the cost of living. What this piece of work will do will be, and Sue, please drop in at any time, will be really to dig in deep as to what people think is an appropriate cost of living or the appropriate expenditure for specific types of families in Jersey.
Okay.
So, obviously we can only do the work that we can afford to do, so because it is so in depth, we will have to look at specific types of families first off. So part of the decision making for the ministerial group will be next to decide what demographics we look at, but I will be making the case that one of those should be a family with children, I think, and we've also had this discussion previously around single parents as well.
Yeah, and I have got some more questions on that, which I will come back to, but I just wanted to cover the community costs bonus. Is that something that's going to be continued? Is it permanent? Is that here to stay, that bonus?
So the community cost bonus is continuing. The team are currently doing the work for the implementation for this year. It's one of those interesting benefits, community cost bonus, because when you look at the background and the reason for it existing, is it was originally implemented as food cost bonus to respond to GST. Obviously now it's become something different to that, and I think what we do need to do is have a look at the purpose of these specific benefits so that we can actually check that they're actually meeting that aim and purpose. So obviously before I was in this position, one of the things that I did bring to the States as a government plan amendment was to expand the number of people that could access that community cost bonus. I am also very cognizant of our pensioner community as well, and there's calls on me for what I can do with pensioners. So I've asked the team to do a bit of a piece of work leading up to the government plan so that we're prepared around some of the things that we might be able to do for our community, and making sure that our benefits are actually doing what we think they're doing, and that people can access them that need them.
Sure, thank you. And is it linked to RPI?
The community cost bonus isn't. It was a set figure. It was increased in 2022 when I looked at that, and this is where this one's a tricky benefit. When you look at the rationales have been political at a point in time, rather than index linking for a specified purpose. So I think we do need to look at whether the community cost bonus is delivering what we want it to deliver.
Yeah. So is there a chance that it would increase if you found that because the RPI increases haven't been there, that it's not actually helping people? Is there a chance that it could significantly increase?
I think this is where we need to balance across all of our benefits. Of course, when we increase something, then you'd have to look at whether affordability and how many people we can then pay that to, and make sure that we've got the correct budget in place. So that's why I've asked the team to do a piece of work looking at kind of all of those different kind of additional components, including things like pension plus as well,
Sure.
so that we can actually see how those things work together for the people in our community.
And that's linked to your minimum income standard work, is it?
That's separate at this point in time. So that's us doing a piece of work in readiness for the budget for next year.
Yep.
The minimum income standard piece of work will be a lengthier piece of work.
Oh, I
It
see.
won't be completed by the time we come to the government plan this year. It will be a piece of work that will be ongoing at that point in time.
When will it be?
We've seen, sorry.
Just one more, and then when would it be complete?
We will need to procure, it's quite a specified piece of work that
Okay.
I don't think we'd have the expertise necessarily on island to do. That's a decision that actually that ministerial group need to make as well around what expertise we want to put to it. We've put money in the budget, or my team and me have put money in the budget to enable us to buy in expertise to be able to do that. But of course, we will need to have that discussion with ministers around, is that the best way to do it? I think if we're going to do this piece of work, it does have to be done properly. We need to know that we've got robust information and robust data that people can trust and rely on.
We've seen concerns expressed excuse me, in the United Kingdom recently about the large percentage of the population which is not working. Is there a risk that we're travelling in that direction?
And that's not a risk that we have currently here, in my opinion. We have very high employment, near enough full employment. In fact, we are dependent on people coming into the island to fill posts. And again, when we looked at the data and looked at the analysis around increasing the minimum wage, we considered that very carefully as well. So we don't currently think that there is a risk of lots of people without jobs on the island.
So is one of the matters that you're considering as Minister the possible disincentive to work by reason of these benefits?
There isn't a situation that I'm aware of on the island where somebody would be better off just on benefits rather than working because of the disregard on earned income. So you will always be better off working, even if you are still claiming income support. In fact, the majority of our income support claimants, I'm sure, will be working and working full time.
So just to go back to the minimum income standard, is there a chance that that work won't be complete before, like by the end of this term of office?
I am hoping that it will be very much complete by the end of this term of office. Of course, we will need to go through the terms of reference and the procurement for that piece of work, but it is on the agenda for the next cost of living ministerial group.
And is that going to be something that will be supported? So given you said procurement, which I'm assuming means a consultant, is that going to be supported by the rest of the government?
I would hope so. This is the type of work that it's not done as a matter of routine. It's not business as usual work. And like I said earlier, it's really important that we get the right expertise. I think there's probably only a few specialists that actually undertake such work. So it's really important that we get the right expertise to get that level of detail.
Is that someone on island or?
No, you've got you basically get social policy units inside universities.
Okay.
So there are only a few of those, and there's one of those few then does this work mostly for most people.
Okay, but obviously there'll be a procurement process.
Yes, if that's what ministers decide to do.
Yeah.
I obviously can't act unilaterally in that case, and it will be up to me to make the case for us needing specific expertise in this area in order to get the very best outcome for islanders.
And how much is that going to cost?
Off the top of my head, I'm trying to remember what we budgeted for it.
It's £200,000, which is the government plan bid from last year. And just to clarify, the money sits with the Municipal System and Economic Development. So it's part of the living wage kind of overall package, which was all the money was put into that department, but it's being done as a project. Yeah.
Okay, thank you. I will come back to that cost of living group in a minute, but just another general one on cost of living. The panel notes that there has been reports of some recent delays in receiving the short-term incapacity payments and income support payments. Are you aware of these reported problems and what steps are you taking to resolve?
I did get asked a Stokes question. I followed up on that. That appeared to be a specific case. Obviously, I don't particularly want to discuss specific cases in this realm, but I asked the department to speak directly with that person. My understanding is in that case it was to do with a bank account and the requirement for a cash payment. We do make cash payments from the Union Street building. So that provision is in place. Sophie?
So there's no other delays that to regular income support payments or STIA payments, they're being processed as normal.
Okay, so there wasn't anything systemic that was identified?
Not that we identified, it was very, very specific to that case.
Okay, and how do you kind of review your systems regularly to make sure that there aren't any little tweaks that need to be made or any systemic issues? Is that part of your business as usual?
I suppose it's we can talk at different from different angles. From a ministerial angle, and I mentioned before, I'm always keen to hear about examples so that I can then look at them. I mean, I get critical cases coming across my desk several times a week, and they come across my desk because they're outlier cases, not because there is an issue with the general procedures within the department.
Yeah.
But it's important, I think, from my perspective as Minister, to look at those outlier cases and say, well, what was the root cause to that? Is there anything that we can do to prevent that or make this journey a bit easier? Because if something's coming to a Minister, that would have been quite a journey.
Yeah.
I know that Sophie might well want to speak about the continuous improvement efforts from the department perspective.
That's it. And so I suppose from our perspective, things like we have a lot of sort of high volume transactional things like payments, but it is we are always trying to look at that sort of end-to-end customer experience to see, are there any points where we can reduce the amount of friction or time taken to do these things. We also do things like, we are continuously sort of measuring, looking at our the time taken to do things, and actually any time we see any outliers in that, we can look to see, can we support with other areas. We look at our risks and sample those just to check that things are working as we'd expect, and we have quite a big focus on sort of performance, which then leads into just continually improving how we do things.
I think we can talk about some quite specific examples as well. So the team have worked very closely with the maternity and the neonatal unit recently to do with the introduction of the improved benefits for premature babies. And that is a process that's really it's hands off from the parents' perspective. So that the team are really keen, where possible as well, to work across government, and I think that's really important.
Yeah.
I'd like to see us being able to work more closely with adult social services, so that's conversations that we've had as well.
Yeah.
Because I think sometimes people think that they're engaged with a government department, there is an assumption that the whole of government must know, but of course we need to deal with data protection and things like that, so making things like that easier, I think.
Yeah, and just to go back to something that you said, Sophie, about your continuous improvement and where there's friction picked up, can you give some examples of recent areas that you've identified and maybe how you've solved them?
So I suppose if I could use the example of the application for income support, that's something where we're always sort of monitoring how to make that as easy as possible. And we know for some people that to actually make that initial application can sometimes be a daunting thing. It's someone feeling vulnerable, they're at a sort of challenging time in their life. So we've done a project looking at that process, and we've almost mapped out all of the individual steps, and we've worked out how can we, we've managed to improve that process even more. There is an online process, but we can absolutely support people if they don't want to use online. We can help with that, and we've looked at how can we proactively, if someone's contacted us asking to apply for income support, and we do need bits of evidence, bits of proof, different things that we need from them. But if we then haven't heard from them, we'll proactively say, look, just how are you getting on with this? Is there something, that we can help with? So to make sure that people
wasn't
aren't...
happening before.
It was not in as sort of organised a way. Like when we actually received the application, we absolutely would be contacted. We'd be on track with people, but that pre-application process, we've definitely managed to improve support.
Yeah, and I've noticed the calculator thing on the website, because that was something that we'd been approached by previously. That seems to be much improved.
And just even we've tweaked the wording with that as well. Something that again we're just really trying to focus on is making sure that people don't feel put off, that this doesn't feel like so just even softening the language around that is around that calculator, for example.
Sounds really good. I mean, Minister, is there anything that you could, kind of what message would you send to people who may be feeling trepidatious or maybe feeling a sense of shame or around applying or receiving income support?
I really don't want people to worry. Income support is the safety net that's there for all islanders. I hear stories all the time, and particularly within the pensioner community, of people that may not want to apply or think it's not for them. I would encourage people to contact the department. That's one reason why we've got a social media campaign going as well, to encourage people to apply, to make contact with the department. It's an ongoing conversation I have as well with our communications team around how we can change the perception around benefits, and just flip that over. Like I said before, the vast majority of people on income support will be working.
So it's not like Philip, you mentioned reports from the UK. It's a different context, isn't it, in Jersey?
Yeah, people will be better off. And I had this conversation with somebody I met with the other week who made the comment, people are better off on benefits and not working. That's not the case. That they will always be better off if they do work as well. And of course we've got the fantastic Back to Work team as well to help people find those jobs and the right jobs for them.
Thank you. I wanted to ask a kind of specialised question around benefit payments to any islanders with a terminal illness. This has come out of the locally assisted dying panel. Is there a process in place to make sure that islanders with a terminal illness, that they receive benefit payments as a matter of urgency?
Yes, we have actually just improved our processes as well. So Sophie can talk about the process improvement, but also we've got, I'm just thinking, we've got the non-statutory.
You've issued law-dotted instructions
Yes, I have.
in the last couple of weeks to absolutely speed up that process, as you described.
So we're making the change to the legislation so that everything is in place legally, but also Sophie and the team have been making some improvements in the meantime as well.
That's it, just things like having key contacts with, for example, colleagues at the hospital, to make sure that if someone is receiving a terminal diagnosis, we can be made aware and we can all be joined up. The last thing we want is someone to have to try and navigate that difficult journey themselves. So if we can get that, we can then sort of make sure, even holistically, we, as a department, we're all
So that would be an automatic kind of notification then, if from the health department to your department.
The law drafting will be the sort of formal part.
So I met a few weeks ago, I went down to the oncology department and met with Friends of Jersey Oncology and some of the staff there. They talked about some of the very practical experience. So obviously I was quite keen to take fairly immediate action, which we've done within the department, and then also within that law drafting instruction as well, which then enables us to have that kind of more seamless process. If somebody's already going through an extremely and incredibly stressful situation, we want them to get the help that they need as soon as possible.
Yeah. And sometimes it's people don't know what it is that they need, and so that's where we can, as soon as we're joined up, we'll make sure, like, right, are they getting everything that they're entitled to? So we can kind of work behind the scenes to do what we can.
So it would be more like the department approaching that person and saying this is what we can offer you, rather than waiting for people to come to the department. That sounds great. And you mentioned that legislation needs changing. When would that come to the Assembly?
Just signed
Okay,
off
so-
on the law drafting, this is where I want to be careful about.
We're talking about two slightly different things which are connected, yeah? I think one's about getting diagnosis, so not all diagnoses are terminology, which is important. And so that's what the work with the oncology recently has been about, people getting diagnosed and kind of like, reassessing their life situation, yeah? And the department proactively helping out, making sure they understand what's available, perhaps something they didn't have to worry about before, yeah? Secondly, and importantly, the terminal diagnosis is something which has come out of another piece of work to where we've identified an area where a law change would be very useful, yeah, because we can create a shortcut, if you like, through the law, and we would use the UK process which is in place for medical professionals, who would sign a certificate to say that the person is likely to have less than 12 months left to live. Yeah? So not to say they're going to die, but it's likely to. So it's very important that the wording is whether you would use, say, from the UK, would not try to create a new version of this, because it's important that people, the medical professionals, are safe and feel confident and feel secure signing this piece of paper. So we'd pick up an existing process, and then the idea would be that process would then bypass all the need for separate medical examination tests and forms and things like that, yeah? And it would give you access to a couple of things. They're not talking about a new benefit, but just quicker access to existing benefits.
And this is the law change that you're
This would
talking
be
about,
a
this
law change,
second bit, okay. Yeah, and when would that come to the Assembly?
In a few months. It's not a particularly big piece of work.
So will it be before the assisted dying debate?
When's your sister dying debate?
It is going to be.
I think there's more.
It's before the end of the year.
Yeah, I think this,
We can
because
check
of the
that.
type of change this
Yeah.
is, it'd be
I'll
good to
check
get
the-
the,
I'll make sure that we're joined up with this at the time.
Yeah, thank you. Yeah.
it's our aim to get these checked because they're helpful changes for people, to try and get the changes through as quickly as possible.
Okay. Thank you.
I think the chair has already asked a related question on this, but the panel is concerned about child poverty, and the Jersey Opinion and Lifestyle Survey report recently stated that 82% of single-parent households find it difficult to cope in 2024. Have you considered the results of this survey, Minister, and what do you intend to do about it?
That is why I'm quite keen that a single parent household is one of the households that we'd look at from minimum income standards perspective. I'm always keen to look again at specific examples so that we can identify what any of the kind of quicker changes that we might be able to make or process changes are. Obviously, subsequently to that meeting that we had with the Childcare Trust, I've asked them for case studies as well, because I think case studies from organisations that are working with families that may be in this situation are always very helpful. And I also have a meeting scheduled with Centrepoint actually this week as well, and I'll be making the same request to them. Because I think those very real situations is where we can see whether there actually might be some gaps where we can look to where there's, shorter term changes, or even people who may not realise that they are eligible for for the benefits that they are eligible for. So again, that's part of that piece of work to ensure that people are applying for what they're eligible for as well. But also the other side is spotting where the gaps are, which are leading to people being in distress as well.
So next one.
Yes, I'm not sure, you might have dealt with this, Minister, but are you considering updating any of the benefit systems in order to target better the right families and the right children?
So if we talk about the actual system itself, the system is due for its major upgrade, and we should be starting that, well, we will be starting that this year, and starting with income support. One of the conversations that I had actually in my ministerial meeting last week was actually how much richer the data will be. The work that we've been doing in readiness for putting the new system together has actually highlighted some gaps in data. So I was pleased actually to have the conversation with the team on Thursday around how they feel that the changes to our system will give us the data that we need to then make the changes to the income support benefits to ensure that people are getting what they need when they need it. Because we have limited data at the moment,
Yes.
so improving that data is really important.
Yeah, that was another question actually that we had, and the Children's Commission has recently spoken about this, and I believe in the JP, and one of the concerns being that the cuts to the statistics unit means that there's actually going to be even less data collected going forwards. Is there anything that you feel you could do to address that and make sure that we get some of that quality data, which is already far less than what, say, the UK have around child poverty?
I think from what's within my remit and what I can do, obviously our improvements in systems will vastly improve the data that we're able to get as a department.
Is that only for people that are accessing income support already though?
Yeah. And therein lies the problem as well. You don't know the people that we're not dealing with. That, for me, is that piece around cross-government work and effective cross-government work. And that then comes across around the conversation around data sharing and interactions between government departments and other government departments feeling confident, people working in other departments feeling confident about making the referrals at the right time through to employment, social security and housing. And that's where I touched upon earlier. I think there's a piece of work that for us to do with adult social services and you know, I've asked for a meeting to be had between my department and health around that specifically as well. I know that sometimes, again, it tends to be the more critical cases. Our department will attend multidisciplinary team meetings. But I think there is that piece of work to give other people, and this is the conversation I had in oncology as well, the confidence to direct people that they think they should be directing back in and say to them, you know, make that application for income support.
Yeah, I mean, but given it's not going to be easy to draw on existing data to understand things like the percentage of single parent households that find it difficult to cope financially. You know, that's quite a subjective measure, which Joel's measures very well and in a very reliable way. Have you advocated for restoring that budget to the statistics unit so that that data can be collected?
I think we had a fairly robust discussion around statistics. We can only do with the budget what we've got, what we can do with it. Of course, the conversation will come around again, I'm sure, around the next government plan as well. I can do what I can do within my remit to ensure that my department is collecting the data that it can, but also the ongoing conversation that we have, and I keep on having with other ministers and in various different groups, is that conversation around data sharing.
With which departments do you currently share data?
We've got on the website there is a number of data sharing agreements that are, but I think there's I suppose there's a bit of a softer side to it, and Sophie, please jump in. Is people having the confidence to use data sharing agreements as well?
That's it. I mean, you've got to have a sort of the right purpose. But so, for example, as well as your obvious, departmental ones, sometimes with specific, we can design data sharing agreements where we see that there's a benefit, and actually it would feel appropriate, but we've got to go through the right sort of checks and balances. So there's a lot of good that can come from that data sharing, and there's examples around things like pupil premium, healthy start, the vouchers for children, those sorts of things, where absolutely we do support into those more wider sort of policy pieces of work, because we know that those are appropriate.
But so you have an existing sharing agreement with the education department?
You don't
You
share.
have to have an agreement for every single purpose. So it's not to say that there's an agreement between Ash and sites. It's much more specific than that. You have to specify what data is and what it's for. Yes. So we have multiple agreements with sites.
Yes.
One for pupil premium.
One for student finance. One for
We can send you some copies if you like. They are publicly available as well.
They're on the website, are they?
Yes. I think they are.
I don't know about the individual ones, but the broad. But certainly there's a number that we can give more.
You're making the balance between government being very efficient and kind of like telling people immediately when anything thinks about anything, and people's privacy. Yeah. And that's a difficult balance to make, and you've got to continually weigh up kind of how far you basically go against people's privacy in order to protect, safeguard their interests. Yeah. That's, some people will see that area here, so we will see it there. Yeah. It's just a complicated issue.
It's no good protecting privacy if the right people don't have the information about the right people.
That's the really difficult policy tension, is to how far do you go to make sure you're protecting people, but at the same time you're also protecting individual people who prefer to be private and don't want to have the help or have the interference or whatever how it is.
Yeah, I understand that must be.
I would have thought that efficiency trumps privacy on most occasions.
It's quite subjective, isn't it? I think you'd get a variety of.
Yeah, where possible, we will try and be as efficient as possible, and it does come down to consent. So sometimes consent-based sharing. So if we can't get a blanket data sharing agreement in place, then it might well be that we look at processes where we can get consent to share data at the earliest possible point in time, so that then the officers working with the individual or the family can do what they need to do as quickly as possible.
Yeah. Okay. So just to go back to you mentioned about the robust conversations around the statistics unit. So I'm reading between the lines that you're advocating for support for that department. Is that something that you will be advocating for in the next budget, and do you think that would be supported?
I think I need to be realistic and say it really does depend on what the budgets are looking for and what those cost pressures are. I think we do need to look at cost pressures in the round, and it would be very hard for me to say I would advocate for one thing when I don't actually know what some of the other cost pressures that other departments have, whether they would be more beneficial to the community than that particular one. What I can say is I absolutely do see the value in data, but obviously I'm very, very conscious about the limited budgets that we're working with as well.
And you're conscious of the calls from people like the Children's Commissioner that addressing child poverty requires sufficient data?
Yes, and in fact I have requested a meeting with the Children's Commissioner so I can follow up on what she said in that article as well.
Okay, thank you. Do you have anything to add on child poverty? Shall I go on to this? You finished on this section? Yeah, okay, great. Okay, thank you. So talking about social security payment gaps, in terms of the UK, and the panel are aware that there's a system whereby members of the public can buy back certain weeks of contributions where they might have gaps. Could you just give us a brief outline of whether that's possible in Jersey and how that works.
Yes, so the UK legislation was different to the legislation in Jersey. I have spoken to a few people in this situation, particularly people who may well have been unmarried at the time that they had children before the contributions legislation was changed and home protection responsibility credits were put in place. This is quite
that?
2001.
HRP was 2001.
Okay.
I think the question's probably a more general question about just kind of general gaps in contribution records. Is that what you're saying? In the UK you can buy years you can buy pension years, yeah?
Yes,
Yeah.
okay, I can answer that more generally and then I can speak to that. So people do have the option to get a quote and buy back. I don't, obviously they would need to take financial advice about whether that was the correct thing for them to do. For people now, we do have a piece of work that is being undertaken at the moment to look at contributions and some flexibility. I've asked, I know that some people, for example, get frustrated because they have all of their contributions and then they're still working and still paying social security. So that's the other side of that. They've got their full contribution record. I'm also very aware that because of the way that our credits currently work, that also has an effect on parental benefit as well. If people have children soon after one another, there are cases where people find that they are then ineligible to receive parental benefit because they don't have their contributions covered for the relevant quarter. So this piece of work is looking at all of that and the changes that need to be made.
Yeah,
so
we will be
kind of
asking
make
more
that
detail
process
about that in our new review that we've just launched. So that's something that we're interested
My
in.
apologies, everything's kind of interwoven. So.
Yeah, it is. Okay, so it is possible for people to do that in a similar way to the UK, but
It is, but it may not be the financial. They need to take their own financial advice as to whether that's the best use of.
The UK government seems to have taken a decision to let people buy extra years at quite a cheap rate. So that has an impact on the rest of the people in the UK who aren't paying a cheap rate. So Jersey does have a way in which you can buy a year that you've missed out for whatever reason. But the Jersey kind of rule is that it's kind of actuarially neutral, So it's not good for you. It's not good for the fund. It's just whatever the cost is,
So what would that look like?
It is quite expensive because you're then paying full rate contribution in for a previous year, So that's the minister absolutely right. If somebody in that situation might want to do that, but they'd be well advised to take independent financial advice as to whether it's better to invest that money in some other way because there might be another product that might be more suitable to them. So it's just possible to do. But it's not one that the government specifically subsidising at the minute to kind of encourage that.
And is that something the government would consider doing, given concerns about lack of private pensions in Jersey?
It's not currently on the work plan, but we will be picking up on the pension saver piece of work as part of the work plan as well. So we can talk about that now.
Yes,
later
I've got pensions, so I might come to that later on so we don't go out forward with our questions. On social security, but slightly different area. The social security cap at the moment is capped at £250,000, so people who earn above that don't pay a higher percentage. There was an amendment in 2022 which would have removed this cap and it was rejected by states members. I wanted to understand whether this is something that you had a view on, whether you considered revisiting that issue.
Of course, my manifesto has a very, very clear view on the cap, and my voting record aligns with that. The Assembly has voted on that in this term of office, so it's not something that I would be seeking to bring back because the Assembly has had its say. I think we do need to consider earnings limits. We need to consider the effect on the funds, in particular any effect that such limits would have on the long-term care fund, which is of course the fund that is the most riskiest at the moment. So that's the context through which I'll be looking at that.
Okay, so not in this term of office. So.
Of course, I will be bringing any proposals through to the Council of Ministers looking forward to this government plan based on what is the best thing to do for the funds. And I have asked the team to look at whether that might be something that we could do with regard to long-term care more specifically.
Right, okay, thank you.
Can I just note that that limit goes up every year, so it's now £317,000. So it was set at £250,000 a few years ago, and that goes up automatically every January.
Okay, 317, did you say? Oh, right, okay, thank you.
Removing the cap would be a fundamental change, wouldn't it? I mean, it would turn a contribution into a tax.
It would do, and like I said, the Assembly has already voted on that, so I won't bring it back.
That's fine. So your answer to that one is no, not in this term of office. Then, thank you. Would you like to go on to living wage?
Can we move to the living wage, Minister? Can you give us an update on the implementation of the living wage?
The minimum wage will go up on the 1st of April, and I've had an update from the Economic Development Minister at the end of last week on the Better Business Support Package as well. Obviously that sits with him. So I was pleased to hear that seems to have gone down well within the business community as delivering on what we need to deliver as government for them to help them raise the wages that need to be raised. And then I will be raising the, this is where I need to get my years correct because it gets the 2026 minimum wage from the 1st of April to the equivalent of the 2/3 of the median wage for 2024. And I'm just trying to recall when the final figure comes out for that.
So that we'll get we need the median wage, and that will be part of the gender pay gap stats report.
Okay.
So there's a very detailed analysis of wages to do the gender one. And as part of that, you guess a median wage, so we'll be able to use that figure, so that will be in the next few months.
And that is to respond as well. Businesses wanted to know as soon as possible what they should be looking at. So
Have you had any response from small businesses, medium businesses?
Of course, the Chamber of Commerce, Jersey Hospitality Association, Jersey Farmers Union will always come and represent their members. So I had discussions with them prior to taking decisions last year. Obviously, the Assembly had set a political course of action that was in place, and a political decision had been made at that point. So it again was about how to enact that decision in the best way possible, and I think we've done well to get where we've got to.
What about financial support for low-earning workers with less than 5 years residencies? Any consideration being given to that?
So of course we did make the payments back in November last year for exactly that cohort of people, which was roughly as much as we could get to the equivalent of the community cost bonus. And then we will be doing the same this year, so the same type of payments will be made this year as well.
You just asked for the dates.
Yes, I did actually. Thank you, Sue. And just last week, I asked the officers to look at what would be the most appropriate dates to look, because we did the way that we did it to ensure that we had people who were eligible was to look at contributions records for 3 months within the year, bearing in mind that a number of people might well be on a 9-month work permit, and probably want them to come back because they've trained on the island, they know the island.
Yeah.
So I want to ensure that the dates that we have don't leave people out, because they
So it
weren't
doesn't
here
have
in
to
the-
be just the 3 months prior
We will
then?
pick the 3 months to take for eligibility based on when we think the seasonal workers will
Okay.
be here. So we just need to look at that
Yeah.
to make sure that we don't inadvertently miss people out that should be getting
Yeah.
that payment.
Sure.
Can we turn to ADHD, Minister? We see a note from the ministerial response to the recommendation 6, I think it was, asked the Minister of Health and you to continue discussions with the Primary Care Board to find a solution to the problem of additional medical practitioners in being able to engage in this particular work. Can you give us a time frame as to when this might be completed?
I think those discussions are ongoing, and of course my action in all of this is to respond to when the Pharmaceutical Benefits Advisory Committee come back and are able to make a recommendation to me to put the necessary medications on the HIF funding list. I think that the major piece of work at the moment is around that shared care agreement, which sits more with the health minister than myself, but of course I'll take any action that I can do to encourage that to be done as quickly as possible, but it's not conversations I'm personally involved in. I don't think it would be particularly helpful for me to be personally involved in those conversations, because they are conversations that need to be had with the specialists that are involved in that. But
there was a recommendation that an assistant minister should be given responsibility for this particular issue, and both ministers, I think, rejected that recommendation. Can you elucidate why you rejected that?
I think that's more in the realms of the health minister's area around ADHD. So I think it's up to that minister how he puts it together and delegates his own portfolio. I think it is an important subject, and I would think that the health minister just want to retain responsibility as well. But I don't want to put words into his mouth.
Are you personally sympathetic to the idea that a sole person should have responsibility?
For ADHD in particular,
Yeah.
I think we always need accountability, don't we? So, and I think that's the ongoing part of the discussions that we're having around health in general and the ministerial responsibilities surrounding that. I'm obviously responsible for the social security or the fund side of things, and the health minister responsible for like the secondary care. The health minister, and you will have been briefed, has got plans to restructure the department. Part of that restructure as well also looks at ministerial responsibilities and shifting some of the responsibilities so that they do come under one minister. At the end of the day, I want the most effective processes and procedures and line of accountability that we can possibly have for islanders.
Okay. So if there were an opportunity to have an assistant minister that perhaps was an assistant minister in your department and in the health department and could oversee this, is that something that you feel that you could support?
I think if we weren't looking at structures, then potentially, using assistant minister roles, that might be. But I currently don't have an assistant minister that would be taking that on. I don't really delegate functions like that, because I want to make sure as well that these things are top of my priority list as well.
And you talked about the Pharmaceutical Benefits Advisory Board. Is that the right? Have I got the right words there? It's PBAC, isn't it? And that you're waiting for recommendations from them, but the final decision lies with you, does it not?
The final decision would lie with me, but it's a very clinical decision that I will look at the advice that I'm given at the time,
That's his own decision to put ADHD drugs onto the prescribed list, yeah? So there are many other decisions to talk about, yeah? So the shared care is absolutely crucial. The shared care stroke other ways of prescribing and overseeing ADHD patients is really key. And there's a variety of different ways which the scrutiny panel did refer to in its recommendations as to how you could do that. And I think Happiness is interested in basically having go almost all of them, yeah. So that's you will need to have lots of different ways of doing it. It's not just about nurses, it's not just about GPs, it's about a variety of different solutions to support people locally.
Yeah, the signing off to put it on the list of medications is an important part, but it's quite a small part in the whole of the thing. So that needs to come at the right time. It would be ill-advised for me to act unilaterally and sign something off against advice when all of the other pieces of the jigsaw aren't in place.
And what's the first, so it's a jigsaw, but what's the first piece that needs to be kind of laid down, as it were?
I think it is around that, knowing what that shared care agreement looks like, and knowing as well that we've got that GPs are confident in the place where they can prescribe.
Okay.
Recommendation 9 of the review considered a programme of activity to support the ADHD Awareness Month, and that was partially accepted, I think. Can you explain why it was only partially accepted, and whether the Neuro-Inclusive Jersey Strategy Steering Group will be making all the plans for the Awareness Month?
I'm just jogging my memory as to why.
Very health-related questions.
Yes, it is. I'm always quite happy to support awareness activities, and I'm sure that my local services team will be at the forefront of that. So I can't.
Funds to deal with that.
I think the local services team are always working in the community and with other organisations to raise awareness. So I would say that they will definitely be supporting ADHD Awareness Month as part of business as usual. I can't explain off the top of my head why it was partially accepted, but I'm quite happy to get back to you. But I'm quite happy to support my team to do what they need to do to ensure that awareness is raised as well.
Great, thank you. I'm going to ask some questions about pensions now. And the pension saver scheme, we previously talked about this, Minister, and you informed the panel it had been put on hold. Are you planning to restart work on this scheme before the end of this term of office?
Yes, we will be picking that work back up towards the end of the term of office. It's likely then that I think further work would be done within the PERDA period as well, so that there's information ready for whoever is in the position following the next election to pick up. It is an important piece of work, I think, within, again, I like to see things across government and across kind of policy areas as well. The piece of work that I've asked the team to do first is also look at the ageing population and the issues to do with the ageing population within the context of the population policy work as well. So I sit on the HAWAG Plus group with other ministers, and it's my intention to bring that through to that group specifically, so that we can actually understand, and I can say to ministers, this is the issues that we're going to be facing. I think there's some work to do around perceptions of the state's pension as well.
Okay.
An understanding of the state's pension and how it works. Again, it comes back to the point about income support. There shouldn't be anybody that's just surviving on a state's pension and struggling, because income support is that safety net that then picks that up.
So the state's pension alone is not designed to be enough for someone to live on?
It was never implemented to be the sole income or the sole thing that somebody lived on. I don't know if that's broadly understood in the community, and it's certainly a conversation that I've had with officers as well around what do people see as the purpose of the state's pension. How do they understand how it works and what it was set up to do? Is it doing what we're expecting it to do? But also how do we encourage people to think about their own future and save appropriately for their future. So that, for me, is part of a much broader piece of work of which Pension Saver Scheme is one component. So I'll certainly be taking this as a topic to the Hayward Plus group of ministers so that we can discuss it in the round.
Okay.
As
And
a policy topic, really.
thank you. And in terms of the resources required to restart and progress the work, are those resources already secured, or will you need to bid for those?
That would be what I'll be working on as part of my planning for the Government Plan 2026. So the team and I have already started working on what we want to see within that government plan. Obviously, that there had been a budget put in place in 2020. 2023. Made it, that was a saving because we paused that piece of work. We will need a budget in place. It is a complex piece of work to bring in a secondary pension scheme. We will also need to make sure that adequate consultation is done as well, so that anything that should be brought forward is brought forward in a way that people buy into it.
So would that be a growth bid, or would you be stopping other work or making cuts elsewhere in order to proceed with the pension saver?
It's not my plan to stop other work. I hope by now you've got a copy actually of the departmental business plan.
Thank you.
And I've asked for that to be done over 18 months so that we've got the clear kind of the work that we're planning to progress during this political term.
So it would be a growth bid then?
I need to see what the budget process is to see whether it'll be a growth bid or not. But again, this comes back to the discussion that we had about Statistics Jersey as well, isn't it? We kind of need to see everything on the table to see what then becomes a priority for additional funding within any department or not.
We talked about consultants earlier, and due to the government-wide consultancy freeze, do you foresee any challenges in progressing the work around pension savers?
I think that when you need to bring in specific expertise, you can make the case. I think, of course, it is important to always think really very carefully around what expertise you bring in. The piece of work around consultants, I think, is more around where people were being used on ongoing consultancy contracts, not for a specified piece of work, for specified expertise. And I think that's where you can make the case, a clear case for bringing in a consultant, rather than just bringing somebody in who's working on a consultancy, but actually you could get the expertise in-house.
Okay, so just to clarify, and that's across the government, that it's just this kind of ongoing consultancy that's embedded within government, that's what the freeze is on, but time-limited use of consultants, that's still an option available to ministers?
I would see it as, I would ask, the points at which I would ask to bring in a consultant is when very, very specific expertise is required that doesn't exist for a time-limited period of time, that doesn't exist within the public sector.
And there is still a process around that with additional sort of CEO sign-off and that sort of thing. But there is an ability to make a case for something which is very specialist.
Okay, do you think it would be supported by the rest of the ministers?
That's a question I'd need to ask them, isn't it? It's not a conversation that we've had, so I'm not going to put words in other people's mouths.
Okay, when will you be taking that to COM?
Around the pension saver
Yes.
discussion. The pension
Yeah.
saver discussion will come around the government plan discussion, I'm sure.
Okay. I'd be grateful if you could keep the panel updated on that issue about the pension saver. Okay. Oh, actually, one more. Sorry, two more questions. You talked about people being aware that the state's pension isn't enough to live on, and other methods where they might save for retirement. And in the UK, I believe there's something called a junior ISA, and there's other similar products, financial products, which are supported by government and people get tax allowances. I'm not exactly sure how it all works, but are any of those schemes or products being considered by Jersey's government, and particularly the junior ISA that might help with also encouraging families?
Not to my knowledge, but this is exactly why I actually want to put this this topic actually on the agenda for the Haywag Plus group, because the issues around the ageing population is something that I can't just deal with myself as Social Security Minister. I have to work with other ministers and indeed the Assembly as a whole to find, I suppose, the whole remit of solutions that we might then use. There might be other levers other than, what was being proposed with the pension saver scheme.
Yeah.
And also, when I speak, because again, going back to what we know from Joel's, pensioners who are homeowners, they would report that they generally feel financially comfortable, certainly more comfortable than, say, your single parents that we referred to earlier. The Jersey pension obviously is an unmeans tested benefit. We need to see that in the context of the other means tested benefits and how they all work together. So I will stop and chat with pensioners, and very often what they'll say to me is, actually, it's not for me that I'm worried, it's for other people. And then they'll say, I worry about those that can't afford to go to the doctor. So one of the things I've asked the team to do is look at Pension Plus, for example, as one of those benefits that we currently have, say, a hard drop-off of benefits when somebody starts paying a little bit of income tax.
Yeah.
So, is there something that we can do for those kind of lower earners in that just above the paying income tax bracket? How do we smooth out that hard drop-off and then do useful things such as, Pension Plus is a really good one because it encourages people to do the right things to look after themselves. It also gives access to the health access scheme as well and cheaper GP visits. So that's the type of thing that we're looking at, that whole piece of work.
Yeah. Okay. And the last question I had on pensions was around gender pension gap. And I know there's some data in the UK showing that there is a gender pension gap. I would expect there to be a gap in Jersey given the way our benefits scheme is set up for the married women's exemption, and also the high rate of domestic abuse in the island. Can you comment on whether you think there is a gender pension gap in Jersey and how we might tackle it?
I'm sure that there is, and this actually goes back to what I started talking about earlier, when actually our systems were improved in 2001, and the married women's election is now being grandfathered. Of course, private pensions and other savings are going to be influenced by pay. So one of the first things to start with there is the gender pay gap. I've looked in my sphere of influence around what I can do around pay transparency. So, for example, I had a conversation with Sophie and her team around what we can do with the jobs in Jersey site, because very often we see jobs being advertised as negotiable.
Yeah.
We already know that women, I think, will negotiate at a lower rate than men would tend to, and that lack of pay transparency does lend itself to bigger gaps, not only in gender but probably ethnicity as well.
Yeah, yes, exactly.
So, within my sphere of influence, what I did in terms of that, speak to that team and try and get them to encourage employers to be more transparent when they're advertising jobs in Jersey as well.
Yeah, that's good to hear, thank you. I'm going to have to move on. I've just noticed the time. A couple of questions about primary care services. Could you give us an update on the progress of the dressings in the community scheme, please?
I'm just waiting because it's a while since I've actually discussed that one.
Yeah.
So my understanding, because it had been implemented as the pilot scheme, and everybody that should have been getting access to free dressings.
It's
Yeah.
running through Valley Nursing at the minute.
Okay.
Valley Nursing are by far and away the biggest provider of dressing type services, yeah? So this is the first part of the whole thing, if you like, at the minute. Running it through Valley Nursing, that's working really well. And a number of local pharmacies are providing products, Valley Nursing identify what you need, and it's completely free.
Okay.
Yeah? There is the final stage would be to kind of make a site expansion on that and to kind of put in place a more permanent contract with the pharmacists and expand it out to other pharmacies, and that's something which is happening at the minute. We're just going through a variety of negotiations with various people to kind of get it all right, yeah? But the service was provided from October-ish last year, so that's up and running. So in terms of the kind of like what it looks like on the ground, it's basically there. Behind the scenes, we've got a bit more work to do to kind of get everything sorted out. But the product is the aim of the scheme is up and running now, yeah.
And when I last spoke to somebody from family nursing about it, they were telling me what a positive impact that scheme had made.
That's great. And when would that work be complete?
That probably depends on the negotiation with the pharmacies, doesn't
A couple
it?
of months probably. There's
Say a
things
couple
like
of months.
a couple of months probably.
Okay.
It's the details of which products do you specify, how do you specify, what happens if you haven't got something in stock, do you do something else. There's just that level of detail which we just want to get through now to make sure we've got a fully robust kind of financial system behind the service. The service is running fine at the minute. There's a certain amount of just trust within how we're paying things, yeah?
Yeah.
All will get sorted out within a couple of months, I think.
Okay, thank you. And another state's decision was on free GP visits for students. Could you give us a very brief update on how that scheme has been received and how it's working?
That has now been implemented. Again, systems-wise, it's similar to the HAS scheme. So, for the most part, GPs will know who the people are that are getting those. So, I think the implementation is now complete. It got done early in this school academic year as possible, so that students could receive their free GP visits.
Great. Okay, thank you. Another area which was a state's decision was the whistleblowing legislation. Could you give us an update on that, please?
Yes, the Employment Forum has been undertaking its consultation, and it will be releasing its recommendations in the coming months.
Okay. And when can we expect to have something before the State's Assembly on that?
They will present their recommendations to me. I will then need to consider those recommendations and then bring law drafting as appropriate.
Okay, will it be before the end of this term?
I would hope it will be before the end of this term. I did make it a priority to try and bring forward States Assembly decisions. I am keeping Deputy Alves up to date with that. She was the politician that brought that particular proposition to the States.
Okay, thank you. Would you like to move on?
It's the case that there's going to be an actuarial review of the Social Security Fund and the HIF and the Long-Term Care Fund this year, is that correct?
The actual review is as at the 1st of December this year, so it has to happen after.
Right.
It happened next
So
year. We wouldn't prepare for this year.
When is that likely to come out?
It will come out during the course of next year. First half next year.
Right.
First half, did you say?
It should be, yes. So we'll try and do the work, we'll try and do as much preparatory work beforehand as possible. But the reviews are as at the end of this year that hasn't happened yet, yeah? So you have to have the data ready, and you probably need to, March, you probably still, there's various types of people who can pay a bit late on their contributions, so you haven't got a fully mature set of data probably until March of 2026. But lots of work will be done before then, But it will be kind of the second, third quarter before you're going to get any kind of results out.
Can we focus on the HIF fund, Minister, because I'd like to press you a little bit, if I may, further to questions that were put in October 2024 when you said that you didn't expect that any action was going to be taken during this term of office to ensure the sustainability of the HIF. The 2019 Actuaries Report and the 2023 Actuaries Report both found that if no remedial action was taken, the HIF would be exhausted by 2035, which is now only 10 years away. Can you tell us whether any action has been taken to remedy the position?
I think that this is something that we need to look at within the broader realms of health funding. This again is linked to some of the work that the Health Minister is undertaking around the structure. He and I speak very often around the pressures on health funding, not just for primary care, but also secondary care as well. And also, of course, as I mentioned earlier, the long-term care fund as well. So what we do need to do is have a look at health funding as a whole. That I know the Health Minister has proposed in his plans to bring the all health funding under one minister. I would be in favour of that because I think it is the sensible thing to do, and I think it is a matter of timing. I think that we need to focus on getting the health structures correct and in place, and then we'll have better information around the funding as a whole and how that best may sit. But I know this is something you feel very strongly around as well, about protecting the money in the HIF for primary care, to make sure that people get access to primary care.
Well, isn't that important?
It is very important. I am in complete agreement with you that it does need to be protected as well. But it's how then...
What's going to happen, Minister, if... because these discussions with health and the health funding generally are hugely complicated, and they are going to go on, I suspect, for quite a period of time. So what's going to happen if the HIF fund is exhausted, so far as subsidising GP fees are concerned?
I don't think we're going to let the HIF fund get exhausted. We'll obviously be informed by the actuarial review that will come next year. But we can't see the HIF fund in isolation from all of the other things that need to be done in health. Today we've been discussing ADHD. The HIF funding component is very much a small, it's an important part of that, but it's a small part of the whole that needs to be done. So we do need to make sure that all of the things that we have are all working together as efficiently and effectively as possible.
So if the HIF is absorbed into overall health funding, will it still be ring-fenced?
That would be my intention, to absolutely have that ring-fenced funding for primary care. But we need to see that within the pressures that health has as a whole. The health minister's the best minister, or the best placed minister, to be able to do that.
I don't understand why action can't be taken now to protect the viability and sustainability of the HIF fund. The actuaries' reports on the last two occasions, and I'm sure that the new report is going to make can say exactly the same thing, shows that projected break-even contribution rates required for income to equal expenditure need to go up. because otherwise the fund is going to be exhausted, and increasing the rate by even 0.5% would surely make an enormous difference to the sustainability of the HIF fund. Why can't it be done?
I think if we were to increase contribution rates at this particular point in time, I can't actually see it passing through the States Assembly. It would be another pressure. We've talked about cost of living at the moment, so it would be another cost of living pressure on people. If we didn't put that pressure on employees, then we'd be putting that pressure on employers. So all of those things need to be thought through. Of course, the other area that we could bolster the HIF fund from would be, other states' revenues. We've got lots of funding pressures across. We've just been talking about funding pressures on health, so we could choose to put it in to the HIF fund rather than the other areas or elements of health. So, as you rightly say, it is very complicated, but we do need to have a look at it in the round. And also within the context of all of the policies that we have and all of the government policies.
You don't have to increase the rate though, do you? I mean, you could assign an additional portion of the rate which currently goes to the Social Security Fund to the health insurance fund.
That could be done. Sorry, when you said increase the rate, I made an assumption that that's what you were suggesting. So apologies.
It wasn't my
for that.
suggestion actually. No.
Then we would need to look at what the effect of that would be on the Social Security Fund, and what changes we may well wish to make on Social Security benefits as well. I mean, we do have a sub-panel of this panel, for example, looking at family-friendly benefits. I know that a number of people feel that those benefits aren't high enough, so we do need to see all of that in the round.
We were told that the Social Security Fund was so flush that money could be taken out for it to support the living wage. So is there not a possibility of moving a percentage from the Social Security Fund to the HIF?
We of course didn't take money out of the Social Security Fund, we reduced the state's grant. I think it's for the betterment of our community that we've got people earning a decent minimum wage. I think that's a good outcome for our community. And again, we always, whenever we make changes, we always do need to look at what the best outcomes are for our community. So we need to look at those as a whole.
Well, I went cross swords with the Minister on whether money was taken out of the fund or not. We leave that run.
Okay. Thank you for your answer to those questions. We've got one final section. Yes, it is the final section on the period products scheme. And you have given us some previous updates. Could we have a further update, please, on how the scheme is progressing?
The scheme is now fully implemented and operating as business as usual. Whenever we do get any media coverage or anything, we do get people or potential venues contacting the department saying, can we be added in? So you're dealing with that now, I think, on a quarterly basis, yes, Sophie.
Yeah.
So that new venues can be added in if they're high footfall venues.
That's it.
Is there a criteria for what venues can be added?
They need to be publicly accessible.
Yeah.
They need to have a fairly high footfall, so that's where the supermarkets have actually been particularly good for those. For those take kind of a monthly supply.
Yeah.
Then with regard to the short dispensers, those are kind of high footfall public toilets.
Yeah.
Because of course we need to make sure that they are filled up and regularly checked. So it wouldn't make kind of financial sense from an efficiency perspective to have lower volume places, but Sophie may be able to add.
We also look at sort of the geographical spread. So if we've already got some accessible, we've got the list on our kind of website. So we're not sort of, this isn't about putting them in absolutely every single location possible, but it's making sure that they're readily available in a range of places spread across the island, and we're getting some sort of good feedback on both the monthly supplies. We're getting through good stock of those, which is almost showing it's working, and the court short has got a good geographical spread.
And do you have any stats on like who's accessing the products, what kind of venues are being accessed more than others?
It's a while since I've seen any
Yeah.
stats, but Sophie.
I mean, the supermarkets are sort of significantly high venue. I don't have numbers on me, I'm afraid, but that would be our biggest footfall. We also have some in the Union Street reception, which go well. We've got some in schools for monthly supply as well as for sort of court short, yeah, generally we don't know who's taking them, but we monitor sort of stock levels through the sort of reorder value.
I think it's also important to take this opportunity to say that we're also, so you've worked with SIPEs so that rather than the schools doing them themselves now, it's through this scheme as well.
Yeah.
So that's the secondary schools and primary schools.
Okay. And in terms of data, possibly after the hearing, would you be able to show the panel some of that data? And we'd be interested to see how you're using that data to make any improvements to the scheme. And in terms of the public scheme, the panel understands that there's no offering of products within Government of Jersey offices. Has that received any criticism?
We do have them in the Union Street building. I'm trying to remember where else they were, and we did an all colleague communication, letting people know where they were within the government buildings.
So I suppose the key thing that we don't have them, and government don't provide them for sort of back of house, sort of behind closed doors. All of the products need to be publicly accessible. However, for example, in Union Street, on the ground and first floor, there are toilets there for customers, but employees can also use those, and that would be the same they're in public toilets in driver and vehicle standards, in schools, for example. So there's absolutely nothing stopping employees, and we've made sure, for example, in the new Union Street building, that if a colleague needs a product, they know that they're just as they're an islander who can use a product as well. So we've tried to there has been communications reminding people of that.
I mean, I think given it's kind of one of the government schemes, should government not be setting an example as an employer and make sure that the products are available in all of the staff toilets in all of their offices?
So it was one of the conversations I think I had with you, Sophie, fairly early on when I took this role on, because that's kind of where my starting point was as well. The thing is, if you're going to do it for government employees, then you should then open that up to other employers as well. It all of a sudden becomes a far less efficient scheme, particularly in terms of if you think about supplying them in every single toilet block in each government building. So it is around efficiency of the scheme, people knowing where they can get those monthly supplies as well. But also it's about fairness and making sure that they're always available to all members of the public. I raised it, and I know Sophie then, following me raised it with the HR colleagues, so colleagues in people and corporate services as well. Then I'm obviously not a member of the State's Employment Board, but that's certainly perhaps a recommendation I could make in my role. Again, this is around my sphere of influence and what I can do, isn't it? Around saying to the State's Employment Board that might be something that they wanted to think about, is providing those to
Could you let
as
us
an
know?
employer.
Because I think that's something I'm very surprised to see it wasn't being provided in for all government employees, and I'd like to understand if that could be done. And also you mentioned private employers. In terms of venues stocking publicly, could private businesses not have somewhere where they could pick up stock for their employees and for that to be part of the scheme that way, so that employers who want to offer that to staff could do that and administer it themselves.
I mean, it comes down to efficiency and value for money as well, and how that then would operate and how much staff time it would take to do. We focused on public areas so that as many members of the public can access products as possible. Of course, good employers and employers may well be looking at staff incentive schemes to ensure, and I would always encourage employers to do that. Whether administering such a scheme would be the best use of public funds or not, that's something that I think need to be convinced about.
But in theory, employers could go and utilise those stocks that are in the supermarket and take them for their employees. That's a legitimate use of the scheme, isn't it?
In theory, we're not going to stop anybody from taking the products. But the main thing is that those products should be there for use. I think in the very early iterations of the scheme, we saw a lot of product wastage, which is why we've improved the dispensing machines in the public toilets.
Yeah.
So if people are going to take them for use, then that's one thing, and then make sure that they're going to be used. But that would be incumbent on those people to do that.
Thank you. And has the full budget been spent for this area?
No, we use the budget on a sort of order on a monthly basis. We know that, this year, we've still got sort of headroom in the budget, but obviously we're continuing to promote the scheme. Uptake can increase, but at this point there is still some flexibility there, which is why we sort of consider new venues, on a quarterly basis. It's not, but it's the sort of thing that we are happy to consider.
And any underspend, could that be diverted to groups such as the Jersey Sustainable Period Products project?
I don't think we've been approached by them, but of course we do provide sustainable period products as well. I did actually hear an interview, I think, on the radio around that the other week, and I did mean to make contact with someone, because I think it was said that the products weren't available in schools yet from the government, but actually they are, and perhaps
is
what
that
we could
the
do.
the reusable products, I think?
And I think that's a question that we need to look at, as well as whether that then gives us an opportunity to provide some of the reusable products. Of course, when we started that pilot with the reusable products, we started them, I think it was in 5 specific venues.
Yeah.
And that's still going, isn't it?
Yes, that's still going. So that's now business as usual, running along. But I think you're correct. The schools are possibly another place where we could look at.
So is that something you commit to today, to making sure that there are reusable products available in schools?
It's sometimes about that schools do have kind of challenges around kind of stock, storage, these sorts of things. So that's why some of the schools, although they want to be as supportive possible, actually they've often signposted to Brooke or to Brighter Futures, or because there are sometimes they have things like the monthly supplies, but they some of those are outside in the more communal areas. They've got things in the individual bathrooms, but sometimes there are practical elements where there are restrictions on how much, just from when you order, you can't keep everything. So it's sometimes not, we absolutely can keep up the conversations.
If you could update us on the progress in that area, it's of interest to the panel. Okay, do you have any final questions on any area? Okay. That's the last of our questions. Is there anything that you would like to add before we close the hearing?
No, nothing particular. I suppose, aside from the fact, obviously, I'm noting that you have the review into family-friendly legislation, so I'll be looking forward to reading that review and its recommendations.
Yes, and we also will be looking at P78. We have a meeting tomorrow that will be looking at a scoping document for that, so we'll keep you updated on that as well.
Thank you.
Okay, and thank you very much for